Hello, everybody. My name is Graham Elwood, and you are watching The Political Vigilante. Thank you so much for making Gotham great again. A great way to support the show is go to patreon.com/Graham Elwood, where you can submit articles like this. This was submitted by Lauren D'Alessandro. Lauren, thank you so much for supporting the show. And you're giving us information like I didn't know this, and now I can put it out to a mass audience. So the surge in surprise medical bills bankrupting Americans can be blamed on private equity. Well, this is just shocking. The private equity people are the most noble, philanthropic group of citizens we've ever seen. And yeah, we know there's soulless degenerates who would set a puppy on fire if it brought their stock portfolio up another dime. So let's go into what this means. Surprise medical bills, okay? Some of you might be like, what does that mean, Graham? I didn't know much about it. It's happened to me, but I didn't know there's an actual term. The term refers to invoices that are generated after a patient is admitted to the hospital and treated without their knowledge by someone not in their insurance plan. So you've ever had that happen? Go to the hospital, mainly the ER, and then your insurance covers it, you pay the copay or whatever, and then you get another bill? It's from like an outside company, not in your insurance plan. Some company you've never heard of. And this is becoming more of a trend, which is shocking. Why, look, medical costs have risen. This is since 1961. In 1961, it was 5% of the GDP. Now, it's 15%. How is that good? People not having money, it's unbelievable. Look at this. And it's projected to go even above 15% as we get into 2021 and 2027. So how are they doing it? The prices of junk bonds issued by physician services companies. What is a physician services company? It sounds like a made-up thing. Have been sliding in the past month as their owners weigh the possibility of costs of political intervention, meaning Medicare for all. That's why these companies, on top of the pharmaceutical companies and everyone else, that's why they're so against Medicare for all. That's why when you watch the debates, there's literally ads, Medicare for all is going to murder your grandmother or whatever kind of nonsense they're going to say, right? That's what their whole scare tactic is. I mean, Bernie said it in the last debate. He goes, there's going to be ads like this right after this. And there were. Then you watch the debates, pharmaceutical companies, oil, car. I mean, it's unbelievable. So what these companies are doing is they saw that there was money to be made in the ER room, and I'll explain that in a second, but let's go into this. These point to the real source of the problem: private equity's silent colonization of parts of the healthcare profession. How have they done that? They found places where they could make the most money and stick it to people. And of course, low-income people, the middle class, the working class people are getting crushed the hardest, right? If you're making hundreds of thousands of dollars and you get an extra bill for $500, whatever, you maybe bitch about it, but you pay it no problem. If you're making 35 grand a year, an extra $500 or $1,000 bill can be crushing. It can be debilitating. That's why 60% of Americans don't have $500 to $1,000 for an emergency. I'm one of those people. Isn't that fun? But a study by Yale University of the billing practices of MCare, Envision's physician staffing arm. So MCare, we know, is evil. They buy these ads. They're buying politicians, any politician that's against Medicare for all. So if you're a Democrat, you just got to say you're Medicare for all, and then just, put in there what we need. We don't want to kick people off their health care. That's a bullshit talking point created by companies like this. Medicare for all is not going to kick anyone off of their health care. But that's the scare tactic. The death panels. Remember they said that about Obamacare? Well, let's look at Obamacare real quick. So we could have had free health care, but Obama and the Democrats, who had control of the House and the Senate, let companies like this and Merck Pharmaceuticals and Blue Cross and all those folks guarantee we didn't have free health coverage. We've got Obamacare, which is, for me, it's a little bit better than but it's not great coverage. It's not great coverage. That's what these companies do. Here's what they did. They showed that when it took over the management of emergency rooms, it nearly doubled patient charges compared with those levied by previous physician organizations. So when you hear this, privatization is better. No, 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 no. Privatization is better for the 1%. It is not better for you. It is not better for me. So always, anytime you hear privatization, know you are going to get screwed. Just know it. That what privatization means is you're going to get screwed. Just bend over and boom, here it comes. And they're going to make a bunch of money. Because here's what they figured out. When they turned these people over, this is what they figured out about emergency rooms. Emergency medical services are a perfect buyout target. So when you or a family member has some horrible thing, fall off a bike, get hit, appendix burst, something bad, choking on something, you're terrified, is my child or my loved one going to be okay? And you go to the emergency room, these soulless bags of shit think, hey, there's money to be made in people's despair. Because it's a perfect buyout target because the demand is inelastic, that it does not decline when prices go up. What kind of evil do you have to go, you know, when someone's really scared they're going to die or their child or their loved one is in a lot of pain, they'll pay anything. That's what they thought. They thought that up in a boardroom. That's why any of these Democrats that say they're meant for Medicare for all but want to have a private insurance option, they're paid off by these evil, soulless sons of bitches. These people cannot see their own reflection in the mirror like a vampire, because you have to have a soul to see it. That's a medical fact. Look it up. I'm sure Wikipedia has a vampire soul mirror page. But this is what they did. If you got to go to the ER, you're still going to the ER, and you're going to pay whatever we make you pay. That's sinister. They're profiting off of people's pain and misery. They're profiting off of it. Just like the private prison industry, the defense contractors, the NRA, profit off of people's misery. Congratulations, you're going straight to hell. On average, 18% of emergency visits result in an out-of-network charge, but it varies by state. That's on average. Texas, red state, 35%. It has the highest percentage of emergency visits that result in an out-of-network charge. Texas. Then New York, California's close. Look at that. So when any politician tells you Medicare for all is for bad, or they tell you that on the news, know they're lying and they're paid by these companies. They're profiting off of you being in pain. Because you're in pain, you'll pay whatever you got to pay, right? This country is the richest country in the history of the world. It can afford free healthcare. How are we going to pay for it? Anybody ask? Anytime they talk about this war in Iran, ask how they're going to pay for it. They want to go to a war with Iran? How are we going to pay for it? We want to send troops to Venezuela? How are we going to pay for it? Or the new F-35 bomber? How are we going to pay for it? Start asking that question. I want all you progressives out there, all you political vigilantes, ask that question everywhere, on every social media platform. Get that out there. You know, the State Department and the deep state and all these people, they get their talking point messages sprinkled all throughout the media. Let's us do that. Call the mainstream media, call them conspiracy theorists. Call Russiagate conspiracy theorists. Call them that. Call them conspiracy theorists, and always ask on all of your social media in conversations with your friends, how are we going to pay for it whenever somebody brings up war? Or whenever they bring up, how are we going to pay for Medicare for all or student debt forgiveness? Always ask, isn't it weird we never asked that about war? Anybody ask how we're going to pay for the global war on terror? It's cost us $9 trillion. Gee, I wonder how many free hospitals we could have in America for $9 trillion. $9 trillion? Free college, student debt forgiveness, high-speed rail from coast to coast, solar panels on every roof, no more homelessness, 6 months to a year maternity leave, you name it, we could have it for $9 trillion. Oh, but we got to go to war so that ExxonMobil and Halliburton and Boeing and Northrop Grumman can make profit. Isn't that fun? Oh, by the way, 50% of medical costs come from emergency room visits. That's why they found it to be a good target price, or whatever they call that. And here's what's starting to happen. People that are running up high medical bills, look what they're doing at the University of Virginia health system. Suing thousands of patients and seizing paychecks and putting liens on homes. So let me just spell this all out for you. These private physician consulting, liar, middleman, mobster firms These people are 10 times worse than a street drug dealer. They jack up costs. They make health insurance horrible. And then you have to pay these extra costs because you went to an emergency room. And then they seize your paycheck and your homes. Do you see this? But if you want free health care, you know what you can do? You can join the military and go fight some bullshit war for rich people. There, you get free health care. Isn't that a great system? Isn't that a great system? Free college. Hey man, just go overseas and come back with PTSD if you're lucky, just that, no prosthetic limbs, but you get free college and you get your health care taken care of. And let's be clear, the VA is pretty shitty for vets. So that's the system we have here. Don't settle for any politician that has look for any chink in their Medicare for All platform armor that has these provisions for private health insurance. It's for companies like MCare and Anthem Blue Cross and those folks, right? And Purdue Pharmaceuticals. You remember Purdue Pharmaceuticals. They just got sued for helping to facilitate the opioid epidemic by lying to doctors. So doctors were telling patients, oh, it's not that addictive. And they're like, man, people with severe chronic pain, they'll take whatever. Oh, ha ha, we got a bunch of people addicted. We've ruined lives and communities and everything else. And now we're going to come seize your home. I tell you what, ruling class, if you're watching this, you better start getting afraid. Because I hope we all come after you. I hope the 99% all realizes at the same moment that you're evil. Because you're done. Your days are done. I'm tired of it. I'm sick of this crap. You're profiting off of people's misery. Private prisons, right? The war machine. This private healthcare nonsense. I mean, they probably sit around and go, God, you know, how can we make more divorce happen? Because is there a way we can make some profit off of that? How can we profit off of, let's get people hooked on drugs. They'll be our drugs. And then we'll put them in jail, so we'll have private, this is a great system. And their only option is to go fight in our bullshit oil wars. Wow, what a great system. Thank you, ruling class. By the way, Ghislaine Maxwell hasn't been charged yet. I'm just throwing that out there. She was at Chelsea Clinton's wedding 2 years after two women settled out of court. She settled out of court with two women who accused her of raping them when they were children and trafficking them. So she's a pedophile sex trafficker, but she got to go to Chelsea Clinton's wedding two years after that. That's just the ruling. That's just one little snippet of the ruling class. William Barr, right? Trump's attorney general, he had ties to Epstein. It's a big club and you're not in it. And this is one way they do it. Stick it to you at every turn. They already seized my home. So thanks for watching the show, everybody. Please go to patreon.com/Graham Elwood to support the show. This show is completely supported by me. I don't get money from Pfizer. I don't get money from, Raytheon. I get money from you. And because you support this show, I can do stories like this. Thank you so much for watching. Go to rockfin.com/Graham Elwood, another great way to support the show. Like, subscribe. Make sure you subscribe. YouTube is unsubscribing people. Watch the ads all the way through. I don't get paid if you click skip ad. Tour dates are at GrahamElwood.com. Thanks for watching.